Psychedelics are a class of psychoactive substances that produce profound changes in perception, mood, and cognition. They have been used for centuries by various cultures for spiritual, ceremonial, and healing purposes. Psychedelics encompass a range of substances, including psilocybin, found in certain mushrooms, LSD, lysergic acid diethylamide, DMT, dimethyltryptamine, and mescaline, found in peyote cactus and San Pedro cactus. The effects of psychedelics are often described as inducing altered states of consciousness, characterized by heightened sensory perception, enhanced introspection, and an expanded sense of interconnectedness. These substances can induce intense visual and auditory hallucinations, synesthesia, cross-sensory experiences, and profound shifts in thoughts, emotions, and sense of self. Psychedelics work primarily by interacting with serotonin receptors in the brain, particularly the 5-HT2A receptors, leading to changes in neurotransmitter activity and neural connectivity. The exact mechanisms of action are still not fully understood, but research suggests that they promote neural plasticity and enhance communication between brain regions that are not typically connected. In recent years, there has been a resurgence of scientific interest in psychedelics for their potential therapeutic applications. Clinical studies have shown promising results in the treatment of mental health conditions such as depression, anxiety, post-traumatic stress disorder, PTSD, and addiction. Psychedelic-assisted therapy involves administering a moderate dose of a psychedelic substance in a controlled and supportive environment, accompanied by psychological support. The therapeutic effects of psychedelics are thought to be attributed to their ability to induce a deep psychological exploration, increase emotional openness, and facilitate a shift in perspective. They may help individuals confront and process unresolved trauma, gain new insights, and foster a sense of connectedness and meaning. It is important to note that the use of psychedelics carries potential risks and should be approached with caution. Psychedelics can produce challenging experiences, known as bad trips, characterized by anxiety, confusion, and disorientation. These substances can also have adverse physiological effects and interact with certain medications or pre-existing medical conditions. Therefore, their use should be conducted under the guidance of trained professionals in controlled settings. The legal status of psychedelics varies across jurisdictions. While some countries have criminalized their possession and use, others have recognized their potential therapeutic value and are exploring regulatory frameworks for medical or research purposes. However, underground use and interest in psychedelics for personal growth, spirituality, and self-exploration continue to persist. In conclusion, psychedelics are a class of psychoactive substances that induce profound alterations in perception, mood, and cognition. They have a rich history of traditional use and are now being investigated for their therapeutic potential. While research is ongoing, psychedelics show promise in treating mental health conditions and facilitating transformative experiences. However, their use requires careful consideration of risks, proper guidance, and adherence to legal and ethical frameworks.